Introducing the Pleur-evac A7000 from the Rain series. In this video, we will primarily demonstrate the A7000 wet-wet system. Refer to the instructions for use documentation provided with the products for complete warnings, indications, contraindications, precautions, potential complications, and instructions for use. The system is composed of one wet suction chamber, water seal chamber, and one collection chamber. Quick disconnect tubing, which allows for quick disconnection and reconnection to a new chest drainage unit when necessary. A needleless sampling port is also located at the junction, allowing specimens of patient drainage to be taken whenever needed. Use only a standard Luer lock syringe to withdraw samples from the connector. No needle is required. Setting up the Pleur-evac A7000 is a four-step process. The first step is to establish patient protection by applying the water seal, then connect the patient tubing to the patient's chest catheter. The third step, if suction is prescribed, is to establish the level of imposed suction. Finally, connect hospital-supplied suction tubing to the suction port on the Pleur-evac unit and adjust the source suction. Step 1. Establishing the water seal. Fill the water seal through the short suction tube using the included funnel. Crimp the tubing by holding the funnel below the top of the Pleur-evac unit. Fill the funnel to the indicated line. Now raise the funnel above the Pleur-evac unit. It will fill the chamber to the 2 cm level of water. The water seal serves 3 purposes. First, with its U-tube manometer design, it acts as a one-way valve, allowing evacuation of air from the patient's chest cavity, but preventing its re-entry under normal conditions. Second, the small arm of the water seal chamber serves as a measuring device for monitoring patient negativity, which is the negative pressure in the patient's pleural space. Patency of the patient tubing may be observed as oscillation in the water seal chamber. Oscillations may not be present when the suction is operative, when the lung is expanded, or when the tubing is blocked or kinked. Finally, utilizing the patented 7-column air leak meter, it monitors the degree of the patient's air leak. If the patient has an air leak, bubbling will appear intermittently with respiration in the patented patient air leak meter. Note the column farthest to the left in which a series of bubbles appears. By observing the furthest bubbling column and notating changes over time, it can be determined whether the air leak is increasing, decreasing, or staying constant. The meter is labeled from low, 1, to high, 7. The higher the numbered column in which bubbling appears, the greater the degree of air leak. Step 2. Connecting patient tube to collection chamber. Now that the water seal has been established, it's safe to connect the patient tubing to the patient's chest drain catheter. Once connected, the patient is now protected from atmospheric air re-entry. Step 3. Setting the level of imposed suction. The third step in setup, if suction is prescribed, is setting up the level of imposed suction or negative pressure. To set up the level of imposed suction, fill the suction control chamber through the atmospheric vent to the desired level. The muffler may be rotated out of the way for easy filling. Make sure you replace the muffler to reduce water evaporation. Step 4. Connecting to suction source. Finally, connect hospital-supplied suction tubing to the suction port on the Pleur-evac unit and slowly increase the source suction until gentle bubbling occurs in the suction control chamber. Gentle bubbling confirms the setup of suction level is being maintained. When suction is not being used, it is essential to keep the suction tube and port uncapped and unclamped. This allows air to exit freely from the patient, reducing the risk of pneumothorax. Patient negativity. Patient negativity can be determined by adding the corresponding level of water in the suction control chamber and the water seal chamber. For example, 20 centimeters of water in the suction chamber is added to 5 centimeters of water in the water seal chamber, which results in 25 centimeters of water of negative pressure in the patient's chest cavity. There are instances when a patient will develop a high level of negative pressure. This may occur with respiratory distress, coughing, crying, or other factors such as stripping or milking the chest tubes and utilizing an IV pump. When negativity increases, the water will rise in the water seal. Beyond the 20 centimeter level, a white float ball will rise, impeding the flow of water and preserving the water seal. Although water could rise above the valve, there is a high negativity relief chamber above the valve to contain the water. Regardless of how high the patient negativity rises, water will not spill over into the collection chamber. This relief chamber allows the patient to develop as high a negative pressure as needed for inspiration. When high negative pressure rises beyond desired levels, the negativity can be reduced by depressing the manual filtered high negativity relief valve. Observe the water level in the water seal chamber drop until it reaches the desired level, being sure not to let it drop below zero. By depressing the valve, filtered air enters the unit. Now the patient negativity is at the new lower level as set on the suction control chamber. The high negativity relief valve can be used at any time to manually vent excess negativity. Note that if suction is not operative or the patient is on gravity drainage, depressing this valve can reduce negative pressure to zero or atmosphere with the resulting possibility of a pneumothorax. Bubbling will cause evaporation over time. Fluids may be added when suction is temporarily discontinued. Use the atmospheric vent or the self-sealing diaphragm on the face of the unit with an 18 or smaller gauge needle attached to a syringe to add or remove sterile water or saline. Angle the needle downward. Increasing the level of water in the suction chamber will increase the suction applied to the patient, and decreasing the level of water will decrease the suction. Summarized features of the A-8020-08LF include wet suction technology, wet seal technology with air leak diagnostics, automatic positive and negative pressure relief valves and high negativity chamber, quick disconnect tubing with needleless sample port. The A-8020-08LF contains similar features to the A-8020-08LF with a few notable differences. Similarities include wet suction technology, wet seal technology with air leak diagnostics, automatic positive pressure relief valve and high negativity chamber, manual high negativity relief valve. Notable differences include 150 milliliter collection chamber capacity, no quick disconnect tubing with needleless sample port, qualitative air leak meter without scales. This concludes our Pleur-evac Rain A7000 chest drainage setup training.